Hi, my name is Lori Hartwell, and I'm the president and founder of Renal Support Network. I want to tell you about a new bill that was introduced into Congress, and it's H.R. 4814, the Chronic Kidney Disease Improvement in Research and Treatment Act of 2014. You know, I thought the same thing. Why do they make titles so long when it comes out of D.C.? But anyways, we got to work with what we got. So to tell you a little bit about the bill is that the first part of it is to expand research and coordination of treatment for people with kidney disease. Now, what that means is we spend an awful lot of money on caring for people who have kidney failure, but there's not a lot of money put into research. So it's asking Congress to produce a report on this disparity, and hopefully by seeing this report, they'll put more money into research. So this is one of the important elements. Another part of the bill is that it's important for patients to have all the options for insurance. Now, I wasn't aware of this, but if you have kidney failure and end-stage renal disease, you're not allowed to get a Medicare Advantage program unless you've already been enrolled in one. And we need all the insurance options we can get so that we can make the best decisions for ourselves. And so that's one of the elements of the bill. The other thing that was kind of perplexing to me, but people actually get injury like through an accident or medication. It's something called acute kidney injury. Now, I learned that people who have acute kidney injury, and they may need dialysis for a couple of weeks, but their kidneys bounce back. The problem is that dialysis providers cannot bill for patients to have treatment in their center. So the patient has to stay in the hospital to get care. So this bill would allow that, you know, when you're in this transition of trying to get your kidneys to kick back in, you can go to your local dialysis center instead of having to stay in the hospital. So that's one of the aspects of the bill. Another part is that there's some disparity in how physicians are paid when patients are on home dialysis. And when they go into the hospital, there are some barriers of payment. So one of the elements is to fix this physician payment element. One other part of the bill is that, you know, one of the things that's important for people with kidney disease is to understand that this is very expensive treatment. And whenever you ask Congress to, you know, put forth some new information, some new ways to improve our care, you have to figure out how to pay for it. So what the bill asks for is for that your private insurance be your primary payer for 42 months, and then Medicare be your secondary payer. So an additional 12 months. And that's how Congress will help pay for the bill. Because we all hear on the news that, you know, we don't have any money, how are you going to pay for it? So this bill actually helps pay for itself through that provision. So what I ask everybody to do is to, you know, go onto our website, go to rsnhope.org, click on advocacy. You can learn more about the bill. Write your congressman. Tell them, you know, to be in support of this bill. If you have any questions, you can call us, email us, and tell them to be a co-signer on the bill. Now, one other thing is that if your congressman is in, you know, your town, or if he's, you know, doing a picnic or out at an event, go up and say hello to them. Tell them that, you know, you're surviving, you're doing well on dialysis, you're grateful for the Medicare program. You know, it's important for them to get to know us, because if we don't have a face on this illness, we're doomed to be cut, and that's not good. So I ask everybody to go support H.R. 4814. Tell your congressman to be a supporter. Write a letter, fax, call, text, and most importantly, meet them if you can. So thank you, and go be an advocate.